Hi, this is Dr. Bharadwaj. I am CEO and Homeopathy, Dr. Fidicus Homeopathy. Today we will discuss on one of the important topics related to men's sexual problems. In order to understand men's sexual problem, it is fundamental to understand the normal function, how men's reproductive system works. In this, you will understand what is the link between brain and men's reproductive organs, and also what are the various men's reproductive organs and how they are going to help. So, what is the function? How do you get libido or sexual desire? Once you get the sexual desire, what are all the various activities that are going to happen so that you will have proper erections, you will have proper pleasure in the sexual activity, and also there is no early ejaculation or delayed ejaculation. You will understand the normal function, how penis works, how testis work, what are all the hormones that are involved, what are all the various structure in the men's reproductive organs. So what is the link between these organs and the brain, how they are connected, how hormones are connected. We will understand normal structure and normal function of the men's reproductive system, so that you will be well aware in advance when we are going to discuss about the men's sexual problem. This is a very important topic for you. I will try to explain as simple as possible so that you will understand what is the problem you have and what is the normalcy without the problem. Let's go to the board and discuss in depth. Here you can see you have two parts. One is brain and one is proper male reproductive system. There is very close connection between brain and male reproductive system. How that goes, we will look deeply into it. First, let's understand what are the various parts of male reproductive system. The main important parts of male reproductive system is gonads. This is known as testes. You can see here, right? This is one testis and this is second testis. These are the two testes. What is the major function of the testis? This testis has two major functions. One is producing the sperms that are responsible for fertilization, and also testis produces testosterone, which is very important hormone in male reproductive system for various things, secondary sexual characters like broadening of shoulders, getting of beard, and also it is responsible for health of all the reproductive structures. If you have good testosterone, your function and structure of all the reproductive organ system is good. And the next part after the testis is epididymis. You can see here, this is one epididymis. This is light white in color compared to testis. This is one epididymis. These are the two epididymis sitting above the two testes. What is the function of epididymis? Epididymis stores the sperm. Sperm is produced by testis and sperm is stored in epididymis, and sperm matures in epididymis, and also it get lot of nourishment, lot of food in epididymis so that it can mature. Once the sperm is matured in epididymis, you can see this tube. There is a small tube here. This is known as vas deferens. So this vas deferens, there are two vas deferens on left side and right side. The main function of vas deferens is to carry the sperm, which is stored in the seminal vesicles, to the ejaculatory duct. This is the ejaculatory duct. You can see it here. This is the ejaculatory duct. The sperm is carried to this duct. Whenever it has to be ejaculated, it has to be sent out. And the next structure you have to understand is seminal vesicles. You can see here, this is the seminal vesicle. So I am enlarging it. This is the seminal vesicles. What is the function of seminal vesicles? Seminal vesicles secrete lot of fluid that adds to the semen. Okay, and various things that are needed for the sperm to mature, to be active. All the energy that requires, all the amino acids that requires is given by this small gland. Okay, this is known as seminal vesicles. Once the sperm reaches the seminal vesicles, it goes into prostate. This is the prostate. Prostate is a small gland in the male reproductive system where urethra from bladder. This is the urinary bladder. Okay, where urethra passes into it, and this ejaculatory ducts goes and meets in the urethra. So this is the prostate. Prostate is the important part of the male reproductive system. It has lot of other functions where you can see here the seminal vesicles. You get ejaculatory duct and urethra where you pass the urine are merged here. Okay, and they continue as urethra. This is the important part you have to understand here. Once this is done, you can see here there are two glands. These are the two pink color glands here. This is one gland and this is the second gland. These are known as Cowper's glands or bulbourethral gland. These also go and mix with the urethra here. So it mixes with the urethra. What is the function of this gland? These glands will secrete some fluid which adds to the health of the semen, health of the sperm, and also it is a part of semen. So there are two parts in semen, right? One is fluid part and one is cellular part, that is sperm. So fluid part is coming from this bulbourethral glands or Cowper's glands. Once this is done, next structure you have to understand is actual penis. Okay, this is a proper penis. You can understand there are four parts. This part is known as root of the penis, where the penis is attached to the bone. This is the body of the penis. Okay, this part is body of the penis, and this is glans penis. This is the end of the penis. Okay, this is known as root of the penis. This is the shaft or body of the penis, and this is known as the end part of the penis or glans of the penis. So you can see here, when you take the cross section here, there are two parts. So this one is one part. Okay, these are two parts, part 1, this is part 2 and part 3. This part 1 and part 2 are known as corpora cavernosa, plural. Cavernosa is plural. There will be two parts, 1 and 2. What is the main function of this part? This is responsible for erection of the penis. Okay, when you have sexual urge, blood flows into it, these two parts, and penis become erected. These are the two parts, corpora cavernosa or corpora cavernosum. Corpora cavernosum is singular, corpora cavernosa is plural. There are two in number. This, when you get sexual urge, these become erectile. This is the erectile tissue. And the next part, you can see here, this is the pink color part and it is extending into this glans penis. So what is this known as? This is known as corpora spongiosa. Only one, corpora spongiosa. So what is the function of this corpora spongiosa? So the urethra is coming into this. When you have sexual urge, urethra will collapse, right? When this expands, urethra will close and sperm will not come out. That's the reason this spongy part, what it does is, it keeps the urethra open. Even when the erection is there, this become hard, this become large, this is enlarged and become erect. The urethra will not collapse, so that sperm can come out of this, or semen can come out of this. That's the use of this spongy part, and this is the end part. This is known as glands. On this there will be profuse. The skin which is coming out of this is known as profuse. It is not shown in this picture. Okay, now you understood what are all the various parts. One is testis, one is epididymis, one is vas deferens, third one is prostate, fourth one is seminal vesicles, fifth one is bulbourethral glands, and next coming to the penis, there are three parts. This is the root of the penis, this is the shaft of the penis, this is the tip of the penis known as glans. The function of these two structures, corpora cavernosum, is to erect the penis, and corpora spongiosa is to keep the urethra open, and so that sperm can come out when this is enlarged. So this you have to understand, so that you can understand the further sessions where we are discussing about male sexual problems. And coming to the male sexual problems, there is one more important part, that is brain. How brain is connected to male reproductive structure, we will check now. Okay, so this is the brain, right? When you cut the brain into half, basically we have cut the brain like this, and we are seeing the one part of the brain from the front side. You can observe there are two important structure here. This is known as pituitary gland and this is known as hypothalamus. Hypothalamus and pituitary are the major parts of the brain that is connecting with your reproductive organs. How they are connected, we will check. You can see now here there is one hormone that is produced whenever the testosterone. See, testosterone is produced by the testis. This is testis, right? Testosterone is produced by testis. Okay, when there is low testis in your blood, this testis releases testosterone hormone into your blood. When the testosterone hormone in your blood goes down, what happens is it sends negative feedback to the hypothalamus. There is blood around this hypothalamus. In this blood, testosterone hormone is low now. When the testosterone hormone is low in this part, what it does is it secretes a hormone known as gonadotropin releasing hormone. So what is this hormone? Gonadotropin releasing hormone. Okay, from here that hormone is secreted. Where does that hormone go? Hormone goes into this part of pituitary. There are two parts of pituitary, right? This is known as anterior pituitary, this is known as posterior pituitary. Anterior means forward. This is the front side, and there is one more pituitary at the back side. These are the two parts of the pituitary gland. From here, the gonadotropin releasing hormone goes and stimulates this part of this pituitary gland. This part of the pituitary gland will release two hormones, that is luteinizing hormone and follicular stimulating hormone. This luteinizing hormone and follicular stimulating hormone, which are released by anterior pituitary in the brain. So pituitary is nothing but a small part in the brain. This will come to the testis. So when these hormones are released, what are those hormones released by the anterior pituitary? Luteinizing hormone and follicular stimulating hormone. This luteinizing hormone is released into blood by this pituitary gland. Once this is released into the blood flows to the testis, and this hormone comes to the testis. Once this hormone comes to the testis, it stimulates certain cells in the testis known as Leydig cells and produces testosterone hormone. See how the brain is connected to testis here. There is one more hormone, that is follicular stimulating hormone, that is also raised by anterior pituitary. What this follicular stimulating hormone does is it directly goes to the testis again and produces sperm, spermatogenesis. Okay, so these are the two hormones, LH and FSH. These two go to the testis and stimulate the release of testosterone and sperms. That's how this brain and reproductive system of a human being are connected, and this testosterone is responsible for health of this penis, health of this prostate. All the reproductive health and reproductive function depends on this testosterone hormone. Now you understood what is the link between brain and reproductive organs, and what are the various parts of the reproductive organs, and what are the various parts of the brain, how they are linked. We are knowing this because if there is any problem in this part or any problem in this part, it is going to be seen as sexual dysfunction or sexual functions in man. Okay, if you have any sexual problems, homeopathy is the best treatment for you. It can completely cure your existing sexual problem, whether it is early ejaculation, premature ejaculation, or delayed ejaculation. You don't have the sex drive at all, or you have low libido, or you are not getting pleasure when you are having sex, or there is no erection or penile erection or erectile dysfunction. Any problem, it can be completely cured with Fidicus homeopathic treatment, and also you can prevent it from occurring again and again. These are all can be done without any side effect. Very safely you can do, and very effective compared to you take Ayurveda, Unani, Siddha, Allopathy. Any treatment you take, it can be done more better with homeopathy, and also it is timely. It means it will not take much time. With few lifestyle modifications and homeopathic treatment, you have high chance that your sexual problems are completely cured and prevented from occurring again. These are all can be done without any side effect safely. What do you get at Fidicus homeopathy? At Fidicus homeopathy, the doctors are passionate, qualified, knowledgeable, experienced, competent, compassionate, and techy. They use lot of technology. And coming to the type of drug, device, and procedure, at Fidicus homeopathy, doctors use high quality technology and best in segment medicines. Okay, these are the important things you have to remember. And coming to the infrastructure, at Fidicus homeopathy, latest technology used, and also we use artificial intelligence in treating the sexual problems. That's the reason Fidicus homeopathy has the highest success rate. There are two types of treatment available at Fidicus homeopathy. One is online and one is in person. On online, you can just have audio call or video call according to your preference. If you have any reports already taken with you, can share with us. If any new reports are needed or new investigations are needed, we will let you know. You can get them done locally and send it to us. Once your case is finalized, we will prescribe the medicine and send the medicines to your doorsteps wherever you are in this world. So if you are in India, it takes 3 working days. If you are in US, it takes 4 working days, and any other country, it takes 5 working days. And coming to the in person, you can directly come to the branch and meet the doctors of Fidicus homeopathy. Just inquire about the nearest branch, take the appointment and meet the doctors. How do you contact Fidicus homeopathy? There are two ways. You can directly go to the website and check all the details. It is www.fidicus.com, www.fidicus.com. And coming to the phone number, +91, it is a country code for India, 7997101303. You can Make a note of this number. Why Fidicus Homeopathy? At Fidicus Homeopathy, we have the highest chance of health. Okay, you have the highest chance of health at Fidicus Homeopathy. Success rate of Fidicus Homeopathy is highest for sexual problems, and the treatment is transparent. At Fidicus Homeopathy, you will know all the details about the treatment, in and out, black and white details about the treatment, and it is your decision whether to take the treatment or not. And finally, at Fidicus Homeopathy, lot of technology is used in the back end, but not in the front end. In the front end means where Fidicus Homeopathy staff communicates with you. Okay, there are a lot of personal communication. The staff is going to take personal care of you. That's the reason Fidicus Homeopathy is the best for any sexual problems of men. Now you have understood the importance of physiology and anatomy, normal structure and normal function of men's reproductive organs. If you still have any questions, get back to me. Thank you.
Fidicus Homeopathy.